It's Amy Slott, A-M-Y, Amy Slott, S-L-O-T-T.
Great. And your official title?
I'm a registered nurse. So I'm Amy. I'm a bedside nurse here at St. Luke's in Meridian in the intensive care unit. Like in the beginning, it seemed like every shift I came in, I always had at least one, sometimes it was two. We normally have two patients as our assignment, but for a long time it was two COVID patients. Sometimes they were both intubated, sometimes one was, one wasn't. And then we had a little bit, it seemed like a little slowdown, and then all of a sudden in the summertime it picked up again. Then at least one of my patients was always COVID. Fortunately, though, over the last few weeks, I think I've only had one COVID patient, so that's really been a positive thing. And it seems like the census here is for COVID patients has gone way, way down. So
What's interesting to me is I was here in the fall when it was really bad, and I'm here now, and there is a different vibe here. What has changed?
well, I think everybody, maybe because of the vaccinations and the fact that things are slowing down as far as the infection rates, that people are feeling more like their normal selves. It's a lot more, people are more open and we're not so standoffish to each other. Yeah, I think it's kind of everybody seems to have a more positive outlook, I think, on what's going on. I probably thought we would be more back to normal sooner than this. But, I'm just happy to see that things are getting better and there are fewer infections and people don't seem to be getting as sick. I mean, definitely there are people that do get very, very sick, but it doesn't seem to me to be as much.
What would you say to the community, just having gone through this for the last year and being here this year? Anything that you want them to know?
Well, just thanking them for all of their support and doing their part of, trying to stay socially distanced, wearing the masks when they can't do that, and just all the nice things that they've done for the first responders, the nurses. Thanks to the grocery store workers, and they've been kind of on the front lines too, not staying home. So, yeah. I'm not going to be as worried, but I still feel like I will probably still be more distant to people and avoid, larger crowds. Not that I'm somebody who goes to big parties or anything like that, but I think that's going to be kind of the new norm for people. They're just going to be a little bit more distance. Yeah.
What do you think you'll remember 10 years from now? What do you think that will be the memory that you have?
Wow, that's a good question. I just remember when it first happened how isolated everybody was, and how when you did go out, there was no one around, and it just felt so foreign to me. I really like going out now and seeing people, and I don't mind the traffic. It's really been better.